So in this video, we'll be studying about the drug called sitagliptin. Now, sitagliptin is an oral hypoglycemic agent. It comes under the class of DPP-4 inhibitors. So in the short video, we'll be just studying about the mechanism of action, adverse effects and contraindications along with the dose of sitagliptin. Coming to the mechanism of action. Now, before coming to the mechanism of action of sitagliptin, I will explain how it interferes with the normal functioning of the body. So this is the intestine. So once we have food, what happens is the intestine releases a group of hormones known as GLP-1 hormone. So what happens is that the GLP-1 hormone then goes to the pancreas and it activates the pancreas cells. Now there are two cells in pancreas, which is alpha and beta cells, which produce two separate things. Now the alpha cells produce glucagon and the beta cells produce insulin. Now what GLP-1 does is that it stimulates the increased secretion of insulin, whereas it decreases the glucagon secretion. This is how GLP hormone acts. Now what happens is, since glucagon secretion is decreased, it indirectly leads to the decreased synthesis of or decreased secretion of glucose from the liver. Now there is another enzyme called as dipeptidyl peptidase 4 or DPP4. Now these are called as molecular scissors. These are called as molecular scissors. Now, why are they called as molecular scissors? Now, they're called as molecular scissors because this agent or this enzyme, it tends to destroy the GLP-1 hormone. So by destroying the GLP-1 hormone, it prevents this following reaction. So what does it cause? It leads to increased glucagon and it also leads to decreased insulin secretion. So this is not good for us. So what we do is the drug sitagliptin, all it does is that it just simply inhibits the DPP-4. Now by inhibiting DPP-4 enzyme, it leads to the activation of the GLP-1. Now, like I said before, when GLP-1 is activated, GLP-1 goes to the pancreas and it decreases the glucagon secretion. It decreases the glucagon secretion as well as it increases the insulin secretion. So what happens when insulin is increased and glucagon is decreased? It leads to a decreased or a stable blood sugar level, or it decreases the blood sugar level if it was increased before. So this is how the drug sitagliptin acts. Now coming to the side effects of sitagliptin, the first one is upper respiratory tract infection. Now if you want to know more about how does it occur, just remember that in the upper respiratory tract or in the lungs, you have the T cells. Now these are the T cells. So what happens is that T cells also have DPP in them, but it is known in another word. It's known as CD26. So what happens is, when you have sitagliptin, it inhibits DPP. So once the CD26 is also inhibited, both are same. So once it is inhibited, it leads to inflammation. It leads to inflammation, or it can even lead to infection-like symptoms. So that is how this side effect works. Now coming to the second side effect, it causes GI issues such as diarrhea as well as nausea. So how does this occur? Now what happens is, I talked about GLP, right? Now GLP is technically an agent which causes gastric emptying. So when you have sitagliptin, GLP-1 is increased. So when GLP-1 is increased, it leads to increased gastric emptying. So when gastric emptying occurs, it usually leads to nausea and sometimes it also leads to diarrhea. Now coming to the joint pain. Now joint pain, the mechanism is not known, although it is hypothesized that the DPP 4 might have a role in the cytokine regulation, etc. So when you inhibit the DPP, it leads to the impaired cytokine regulation, which further leads to joint pain or arthralgia. Coming to the contraindications, it is contraindicated in any patients who's currently suffering from pancreatitis or who has a history of pancreatitis. The reason is quite simple. See, when you take sitagliptin, what happens is that you overwork your pancreas. Your pancreas is always in a overstimulated state. So what happens when your pancreas stays overstimulated for a long period of time? It leads to hyperplasia or overgrowth of cells. It leads to hyperplasia, or it can also lead to inflammation. So what happens when a person who had pancreatitis takes sitagliptin? He has a more chance of getting back he has a more chance of going through the recurrence of pancreatitis. He's more prone to pancreatitis again. So that is why it is contraindicated in patients with a history of pancreatitis. Coming to renal impairment. Now renal impairment, now it is contraindicated in patients with renal impairment simply because sitagliptin is excreted in urine. So if the excretion from the urine is blocked, what does it lead to? It leads to accumulation of the drug. Now, accumulation of drug to toxic levels is not good for our body. So that is why it is not suggested, or it is contraindicated in patients with renal impairment. And coming to the last one, which is hypersensitivity reaction. Now, what happens is that in this thing it says that DPP is oftentimes DPP4 is responsible for breaking down proteins such as substance P and bradykinin. So what happens when you inhibit this thing? When you inhibit DPP4, it leads to the a decreased breakdown of the substance. So the patient is most likely to prone to suffer hypersensitivity reactions such as Johnson syndrome, etc.